I've been coming to Eastside Clinic ever since 1966 when it first opened. Here is more like you part of the family.
The Eastside Health Center in all these years is like a family. And you're not a number or disease. You're like a family member.
Eastside Clinic was the first community health center west of the Mississippi. It was one of the first 3 recipients of the community health center funding. And in 1966, Eastside Clinic opened.
It was in a bakery. 2 years later, they opened a second at Westside. And then in very short succession, we opened places like Park Hill, like Westwood.
I began at Denver Health in September of 1985, and I originally worked at Eastside for 31 years, and now I do part-time over at the Montbello Clinic. My mother was part of the committee that started the talks about opening up a community health center. And so she was one of the original employees there at that clinic. So I remember going to Eastside when I was around 4 years old for my first checkups and, meeting the doctors and all, and just ended up falling in love with that place.
When the health center came in the neighborhood, we thought it was a treasure because you was able to come to the neighborhood and go see your doctors. It's right here. In the center of the neighborhood. You get to see the same doctor, and that's how you get to know one another, and they get to know you, and you get to talk to them and tell them things, some of your personal business or stuff like that the doctor will know to help you with your mental, body and soul. It helps, it really do.
I remember seeing young people in the teen clinic who have went on to be mothers and now grandmothers, and I've taken care of their children and now grandchildren. And there are still those families that opt to come and see me. And I feel like if they're willing to come see me, that I'm certainly willing to go see them. And then when you're part of the community, I don't look at it as I have to go to work or I have to go. No, I get to go. I get to go to the clinic.
We also try and do as many things within community health centers, not just primary care, but behavioral health, dental services, we have pharmacies, we have labs. And we do that within the community to make it more accessible for our patients and more patient-centered.
It's kind of hard for people to get out to the main hospital. So with this clinic being right here, most people can walk right over here,
This really served the East Side. This is like a part of me, Denver Health.
I think you get the best of both worlds in our family health centers. You get the quality care that is located in your community and being a part of the community, as well as the access to our integrated healthcare system at Denver Health.
All the neighborhoods that needs a clinic in it, they have them because Denver Health is there.
We are the 5th largest out of over 1,700 in the United States, and we care for over 200,000 unique patients a year in our community health centers.
Over the ensuing years, we opened many more community health centers across the city. While we want to celebrate all of the community health centers that we have currently, I want to make sure that we also celebrate Hyde Park, Glowville, La Mariposa, community health centers that are no longer in our healthcare system, but I want to make sure that we recognize the legacy in those neighborhoods that were represented before.